everybody. Welcome back to Dee and Doug Retire. How are you? I hope you're doing well. I hope you're doing well. If you're new at my channel, please consider subscribing, ring the notification bell, and give me a thumbs up. You know, you always have to do these YouTube-y things, but if somebody is new here, maybe they don't know, and it's free to subscribe. Anyway, I wanted to talk about healthcare. I did say it in my last video, you know, we skirted around it a bit, but because I was the person that had to get the health care, Doug, because he was 67 and a half, collecting Social Security, getting on Medicare, and getting a supplement, well, he was sort of done, and prescription drugs. Me, I wasn't. So I had to get health care for myself. And let me tell you something, that was extremely scary for me because on November 31st, his health care from his job was ending. And I went, oh my God, you know, I'm not 18. I was 63 at the time. I'm not a kid. So I went, oh my God, I have no health care. Come December 1st, I'm going to have absolutely no health care. So I was scrambling, and I mean scrambling. I got on penny.gov. You can go on it as well and check it out for yourselves. It's basically the marketplace with lots of different tiers. It's Obamacare. That's really what it is. And it sucks, just so that you all know. I'll be the first to say it. It sucks. I'm right now playing Russian roulette. Let me explain to you why I'm playing Russian roulette. When I finally got on the website and I looked at different things, I was very confused. There was an 800 number. I called the 800 number. The person was very nice. They were trying to tell me stuff, but it wasn't registering in my head. And they finally said, listen, there are agents out there that sell this insurance, and you'll get to pick anything you want. And I went, you know what? Maybe that's the route I should go. The person gave me 3 names of 3 different individuals that were in my area, and I went to one girl that was right inside the mall. It was an insurance place. I went, I made an appointment, I spoke with her. She sold me nothing. She said, let's look everything up. Even though she gets paid commission by certain insurance companies, she didn't sell me a thing. I already knew basically what I wanted to stay in for the year, which was Geisinger, okay? Because Geisinger is around my area. So I figured, well, I'll stick with them for a year until I turn 65. Because Geisinger is not all over the country. So I just said, well, I'm here for now. I'm living in Pennsylvania. I'll stick with that. We did that. Now, it came to deductibles. The first 2 questions any person's going to ask you when you go into the marketplace, make a phone call, or see an agent, what medication are you on? How much money do you make a month? We're a married couple. So I had to put my husband's salary in there, along with my itty-bitty Social Security that I was collecting. Ridiculous. When she found out I take no medication, knock wood, please, knock wood, she was like, oh, okay, so you're not on any meds. So they have an idea, I think, prior to them going through the chart of different plans. Because after all, when you say to somebody, I'm on heart medication, blood thinners, high blood pressure, diabetes, they know all the medications you're on. They have an idea of how sick or not as well as you could be, right? And they know where to guide you and how much it's going to cost you. Because it's going to cost you a lot of money if you don't want to pay high deductibles. Well, I chose Geisinger. At one point, she did say to me, well, how, you know, what's the deductible you'd like to have? I said, well, no more than $2,000 a year on a deductible. Well, it was so expensive for the insurance. I think it was $700, just for me, $700 a month. Not a quarter, not a year, a month. $700. I'm going to tell you something. I was blown away by that price. I was like, are you kidding me? But she wasn't. So this is when I started thinking, oh my God, let's up the deductible and see what happens. We go down. And she goes, well, what about $95 a month? I said, what's the deductible? She said, $8,900 if you stay in network, $17,900 if you don't stay in network. Isn't that scary? Think of those numbers. Isn't that scary? So I said, listen, I'm going to play Russian roulette with you. And she had no idea what I was talking about, but I knew what I was talking about. I said, let's go with the $95 a month, which is garbage, okay? When you have that kind of deductible, this is insignificant insurance. This is catastrophic insurance, and that's what it is with no prescription drugs, okay? So this does not include your drugs. This only includes doctor visits and hospital. God forbid I have to go, but no drugs. So if I need, it's say an antibiotic, it's coming out of pocket. If I need, if God forbid I was in some sort of accident and I had to go to the hospital and they had to give me drugs, to take home or whatever you have to do, to fill out prescriptions, that ain't happening. That's coming out of pocket. So it really does leave you between a rock and a hard place. This is why I say be very careful before you retire and get all your eggs in one basket, because this was something I was not seeing coming. This was not coming to me. I had no idea when Doug came home and finally put the nail in the coffin and said, well, I'm going to retire. I was shocked because I knew it wasn't about the money. It was about, oh my God, I need insurance. Again, I'm not 18. I'm not 20 where you could take a risk of not having it at all. You need it. But right now I'm playing Russian roulette with this $95 and high deductible. So be very careful before you, especially if you have spouses that are on your insurance, and because a lot of women are on their husband's insurance. And if they ever quit their job or decide they're going to retire, you're out there blowing in the breeze because they may have their Medicare going to kick in and you're going to stand out there and have nothing. So it depends on what you can afford. Check that out before your husband or wife, whoever's going to retire first. Make sure you check out what is it going to cost you for individual health care before you put your foot on the gun and say I'm retiring, because it's going to be an eye-opener. Anyway, that's what I wanted to tell you. Quick video, very quick. Just be kind to one another. The heart is all that matters. If you have any questions or comments, you can leave them in the comments section below. I'll try to answer them. Or if you went through this, please let me know how that made you feel, because I'll tell you what, it made me feel crazy for a while. And a lot of you have already commented saying, I can't wait till I turn 65. And I get what you're saying, not to have to pay this out-of-pocket insurance. It's nuts. Okay, everybody. I hope you gave me a thumbs up. I hope you consider subscribing, and I'll talk to you all soon. Mwah! Bye-bye.